In terms of learning objectives, we'll be covering some of the evidence-based medicine, describing some specific interventions. We're going to limit it to depression, anxiety, bipolar, and sleep. While identifying root causes is more at the root of functional medicine and integrative psychiatry, they both lead to treatment and to happy patients. Often, your initial nutraceutical interventions can get you on first base and can produce some benefits during the first month or two of treatment, while you're pursuing the more time-consuming, expensive diagnostic tests in the functional medicine realm, while you're doing gut work, dietary and other interventions that take more time to take root. Some general considerations regarding safety is quality control. Even some of the high-end products that are manufactured in the U.S. are using base products that are manufactured in China and India, as are most pharmaceuticals nowadays as well. Different formulations, even for the same biotherapy, particularly if we're talking about botanicals. There could be interactions, even though they are nutraceuticals. These are real therapies. Patient preference, essential to informed consent. It really speaks to an important matter that, there's, in my mind at least, I'm not against medications, I'm not against supplements. I'm really for joining the patient, establishing a treatment alliance, promoting a shared sense of mission, and then, helping the person with their initial presentation. Usually they're acute, they're looking for a pill if they're seeing a psychiatrist, getting them past that initial acute phase into a period of maintenance and then on to wellness. Okay, magnesium, an essential nutrient, a giant in terms of micronutrients, often overlooked. It doesn't hold the same potency perhaps that SAMe and many other biotherapies do. There can be interactions, very well tolerated in terms of serious safety concerns, although GI side effects are common. If someone has chronic kidney disease, you need to be mindful of that, since you can get greater retention. So B vitamins, big. They can be used as monotherapies, but most of the evidence base is as adjuncts. We have B6, 9, and 12 that really stand out for the CNS. But really, it's there's value in all of the B vitamins. The use of methylfolate is to some degree, in my mind, determined by a person's MTHFR status. It's a test that you can get done with Quest and LabCorp. Most insurance plans will cover it. Medicare does not, so you don't want to get your patient stuck with a $400 list price bill. Vitamin C, I don't really think of it, but I mean, there's actually substantial evidence base, mostly from last century.